she put together a variety of themes for us to look at and consider. And immediately, we all just felt Be the Village stood out. It just really exemplifies a guidepost in our work of primary and secondary prevention. You know, when we think of Be the Village allows each of us to picture how in our everyday actions within our personal lives, our professional lives, that we're living out the 5 protective factors, essentially modeling for our communities to witness how we can elevate caregivers' resilience, how promoting and supporting opportunities for social connection supports families, providing opportunities for caregivers to learn the ages and stages of child development, supporting their efforts and helping their children learn those important social and emotional intelligence, learning where families can turn to during times of need to provide concrete supports. As professionals working in this field, you understand how child maltreatment is the result of a multitude of factors. And by changing our social norms, by being the village, we can emulate to the world and have this vision of where children and families could truly thrive in safe, stable, nurturing relationships and environments. So our team loved this year's theme so much that Prevent Child Abuse Georgia is adopting it as our motto, as our charge. And we're asking each of you to join us, not only over the next couple of days during this conference, but in every day to be the village. So before I hand things back over to Dr. Angie Boy with the center, with Stephanie B. Blank Center for Safe and Healthy Children at Children's Healthcare of Atlanta, I'd like to ask each one of you to go out to the chat right now and to share with us, what does being the village look like for you, and how we or how you perhaps want to be the village for your world, for your community. So thank you again, Dr. Angie Boy, please take it away.
Great, thank you so much. We want to look at the prevention triangle, and this is what we believe the prevention triangle should look like. For those of you that were with us last year, you saw the 2 triangles. This year we've shortened it. We're just going to talk about one because we're really focusing on what we think it should be. And being the village is really flipping this triangle. And so what we want is to create communities that are really focusing on that primary prevention, focusing on strengthening our families. So we're intervening before maltreatment ever occurs. So that can look like a lot of different things depending on the community. We're talking about economic supports, concrete resources for families that can support them through whatever situation they're going through. We're talking about early childcare and education, making sure our students have access to quality childcare from the very beginning that then can nurture them and support their families as they continue to grow. We want to have parent education available. You know, if you move to a city and you don't know anybody, it's hard to parent. And so what kind of educational supports can we give to our families so they feel better prepared to take care of a child? So much of what we see when we're talking about neglect is a lot of times because parents just didn't know, they didn't get the education, they don't have anybody to talk to. So by putting those supports in place, we can prevent that neglect from ever occurring. So we really want to focus on how we can best support parents. Then in the secondary, we do recognize that there are some times where there are higher risks. And so we want to help parents address those risk factors, whether it's something like domestic violence or substance use, parenting skills. You know, maybe they just need some extra help in learning how to navigate the difficulties of parenthood. So we're surrounding and wrapping services around those families to hopefully prevent the need for foster care. And we are supporting those families so our already overburdened system doesn't get even more burdened. then there are times where we're going to need that tertiary prevention where maltreatment has already occurred and we need to protect the child and support the offending caregiver or caregivers. So that could be foster care to give the child a safe place, and we're supporting that child. We're supporting those foster parents. Then we're also supporting the offending caregiver, offering them parenting classes, helping them address substance use issues if that is what is impacting their parenting. So at that point, we have the child welfare system involved, and we need to be able to do that. But the hope is that if we're spending much more time and more of our resources on this primary prevention, we can lessen the amounts that we need to spend on the tertiary and secondary prevention. And that's going to take policy change at the local level, at the state level, and at the federal level to really focus on these true primary supports, because it's apparent to all of us that work in the field, what we've been doing isn't working well. And so how do we change that? And some of the sessions that you'll hear over the next 2 days will really give some insight into how we do that and give you as youth serving professionals ideas about how we can better be the village for our families. So with that, I want to turn it over to Dr. Jill Walsh.
Thank you. And so a great way to further conceptualize being the village and that primary prevention that Jennifer and Andrew were talking about are the protective factors that we have up here on the screen. And we've already alluded to these. So parental resilience, social connections, social and emotional competence, concrete support in times of need, and knowledge of parenting and child development. These protective factors are part of a framework from the National Strengthening Families, and they're promoted here in the state with the local Strengthening Families Georgia initiative. And also to the right are some more examples of work that we know is being done right here in our state that really exemplify Be the Village and those protective factors. So as they further fill in there, the First Steps program, nurturing parents and families, all the home visiting, having local mental health fairs, the new findhelpga.org, which we're featuring during the conference as well, offering just a parents' night out so they can self-care or socialize with themselves are all great ways that we have seen here in the state and recorded in our data. So parents cannot and should not be expected to go it alone when engaged in the important work of raising children. So that is a quote and a really core element of the book Parent Nation, which we're featuring the author of tomorrow in our keynote speech. So day 2 keynote speaker will be Dr. Seth Kine coming from that. And of course, COVID taught us the importance of social connections. If we didn't already know anyways, it brought it to the forefront and hopefully helped many find alternative ways to stay connected. So how many of you guys probably got on a Zoom chat with friends you hadn't seen in forever and might not have done anyways? So it's teaching us new ways to connect and just that importance of connecting and maintaining that through any times. And so that's something we really want to be fostering as entities and organizations, as professionals and community members throughout our state. So I have some really great examples from our local Prevent Child Abuse Georgia councils on the screen. So at that top right, we can see the beautiful community playground at Children's Haven. And you can even see maybe that little fire pit is in there as well. So not only for children to be playing, connecting, but for the adults and the parents and caregivers to have that connection and support within their community among each other as well. And then in the middle, we see a family fun day from PCA Rockdale Newton, and also a free family field day from Bright Paths in Athens. So all of these ways to locally connect. The child abuse prevention programs don't look like abuse or anything like that. They look like strong, supportive families and being the village around them. And I also have bulleted on this screen is Connections Matter Georgia, a training to help people understand the importance of relational wealth and preventing and mitigating adverse childhood experiences. And in our second link there, we have the parent and community cafes through Strengthening Families Georgia, which is helping facilitate a more organized way to help parents and caregivers connect within their communities as well. And that is at strengtheningfamiliesga.org.
I was looking at the chat and I'm just seeing so many wonderful examples, non-judgmental, empowerment, listening, being there, filling in the gaps, wonderful, wonderful examples. Concrete supports is another example of how we can be the village for families. And over the past year, Prevent Child Abuse Georgia has taken the opportunity to listen to all of you, to listen to our partners and our stakeholders. And so this past April, we launched Find Help Georgia. Our 1-800-CHILDREN helpline is still there, but it's better and improved. So we hope you will join us tomorrow during your lunchtime. It's called Resource Hour. And we will be one of the opportunities that you can sit on and learn about. Those of you that have already attended one of our CBO workshops, claimed your organizations, toss it out there in the chat, toss it out in the live feed. Let us know what you think about Find Help Georgia, and encourage others. So we hope you'll join us tomorrow during the resource hour. But Find Help Georgia is the state's virtual resource hub. It is a mobile app. You can still call 1-800-CHILDREN. You can chat with a resource information navigator. And then you yourself, it can become a certified resource navigator through Find Help Georgia. So we hope that you'll look at it a little bit deeper if you haven't. And if you have, be an ambassador and help others know and learn more about how this incredible tool is going to change the way we destigmatize the importance of needing help, asking for help, and acting on that need. And it's okay. We are okay when we reach out for help. Thank you. And that's me too. Oh, those of you that have read the Parent Nation book, those of you that have not, you're going to want to. This is our Georgia Essentials Childhood Read for the state. We've been doing a launch with the author. We've done that earlier in August. We've also, DFACS has partnered with Inclusive. There's a conversation around this, but one of the things you're going to hear Dr. Dana Suskin talk about tomorrow is this idea of parent villages. And they are providing a free toolkit, free curriculum, free handouts, you name it. You are going to be able to have this as a tool that you can use to engage parents. When we go back out to the chat and we see the words empowerment, helping our parents become the leaders, building upon their strengths, that is what building a parent village is all about. And you're going to be able to learn more about it. Our local councils, our September 22nd meeting, that's what this is about. You're going to have an immersive training where you're going to get to be able to learn more about that. But you can also reach out to Parent Nation, and you're going to be able to request this training or join one of the trainings that they're holding regularly if you too would like to be able to offer parent villages within your community, within the parents that you serve. So really excited for you to hear more about that tomorrow during the keynote with Dr. Dana Suskin. We love each year receiving the nominations for the Mark Chaffin Center Award. And we have two very deserving awardees this year. One of our very local Prevent Child Abuse councils, we are excited. Holly Rice, Executive Director for the Family Support Council in Dalton, Georgia, was nominated. And this is what her nomination had to say about her. But she entered the world of child abuse prevention in 1998, where she took the helm of Northwest Georgia Council on Child Abuse. She had previously been involved in the community with teen parents and was aware that many of them had been sexually abused. She took on an agency that was struggling in the late 80s, with only a few dedicated people planning at a kitchen table, and after hard work and dedication, was ready for new leadership. Holly took the reins with quiet passion, bringing together two other community agencies under the Child Abuse Council umbrella. Because of the varied needs of each component of the recreated agency, the Family Support Council became the new name with child abuse prevention at its forefront. As director, she has led the agency and the community in the prevention of child abuse for almost 25 years. She is known across the state as well as the local community as a person who stops at nothing when children need to be nurtured and protected. She leads a staff of 37, 7 different programs, and Holly is well known and respected in the community for her passion about child abuse and her integrity, dependability, and willingness to do anything that she expects of her staff. And one of the things that I can personally recognize is Holly's willingness to be a mentor to other councils that are looking to broaden their footprint, to have a better understanding, and looking at her as a mentor in this work. So congratulations, Holly. We're so excited for you.
Thank you very much. It looked like I was just going to leave the room there for a minute, but I decided I'd stay after all. I deeply appreciate this award, particularly coming from Prevent Child Abuse Georgia, because you are such a stellar organization that has just been brought light years forward by Jill, who has been around for a while, and Jennifer, who's fairly new. But I feel in many ways when I've thought about this award, I feel like I've come full circle, because when I first started this job, I absolutely did not know what I was doing. And I had, fortunately, Elaine Butler was on my staff and she nurtured me along. But then Prevent Child Abuse Georgia sent David Ernest, who became my very good friend and mentor. And he was able to teach me how to navigate the nonprofit world, as well as to understand how all of the systems fit together, and to show me, help me form a vision in my mind of what a community looks like where all the children are nurtured and cared for. And I'm particularly honored this year because I know that last year David received this award, and he is not with us this year. I feel 100% sure that if he was with us today, that he would be pleased that I'm following in his footsteps. I also think he would be saying, I wasn't sure how that was going to work out. So I know that well, I know how much I miss him, and I wish he was here today. This is very, very humbling because I couldn't achieve anything without my staff. And many years ago, when I first started this work, I took a long, hard look at myself. And I really identified the areas, the many, many areas where I was weak. And I decided that the only way that I would accomplish any of my goals would be to find people to fill those gaps. And so I hired people who were strong in the areas where I was weak. And then I learned to appreciate them, and they appreciated me. And together we just made an incredible team. We all know that organizations need dreamers and they need doers. And boy, do I have those. I have Mary Smith, who always comes up with great ideas about things that we need to be doing to improve our community. And then there is Caroline Pence, who is the heavy lifter, who makes sure that what needs to be done is done. I couldn't make it through the day without Nancy and Annette, who ensure that I stay on task. And that is not an easy job. And I appreciate that every day. And I appreciate Rita Wagers, who tries very hard. Oftentimes, it probably feels pretty hopeless, but tries very hard to make us look good, clean us up, make us look good. And then I've been blessed with an incredibly dedicated and competent staff of program managers. They are just dedicated to their vision. They're hardworking people. They make sure that we get where we need to be and accomplish our goals. And then the direct staff, the folks who are working person to person with all of the many different situations that we encounter, they are absolutely the best. They love the families they work with. They believe in the mission of prevention, and they combine all of us together, make a great team, and I'm proud of everyone. I also need to thank my board because they have stood behind me 100% in everything that I've tried to do. And I could not ask for a more dedicated or passionate or supportive group. I also need to thank my husband, who has always been my biggest fan and my most steadfast support. And I appreciate all the years that he has stood behind me and wanted nothing more than for me to go after the things that I wanted to do. But today really meant a lot to me to have an opportunity to thank my mom, because my mother is, of course, the most amazing person in the world. But from the day that I was born, my mother and my father set out to make sure that me and all of my siblings had the best possible childhood. And they both worked to ensure that we were all safe and felt loved and nurtured and were provided opportunities. It was the best possible childhood. So when I got started in social services and I saw that vast disparity between the childhood that I had and the childhood that many of the children that we work with have, it really truly became my life's goal to try to close that gap and try to help those families, to strengthen those families and to help them be able to offer childhoods to their children similar to what I had. So I want to thank my mom. I think she's up from North Carolina, and just want to say thank you, Mom, for always being that guiding light and for impacting the lives of children that you will never see or know. And thank you, Jennifer and Jill, for this opportunity.
And I hope you can see the chat box. We're going to save it for you, just
Okay.
with the resounding congratulations from your whole team and from many, many others who you have likely touched their journey helping to protect children as well. So we are so thankful. And I love just the connections to your community and support and really being that link for others. So thank you so much, Holly. And we have one more person to recognize this morning. So we're going to hand it off to Angie.
Thanks, Jill. And thank you, Holly, for all your hard work and dedication to the families you serve. I have the opportunity to give the Impact Award to Dr. Terri McFadden. She is not able to join us today. She's actually out of town, but we will get the award to her. She is the medical director of the primary care clinic at Hugh Spalding Children's Hospital and is a professor in Emory School of Medicine. She is just an amazing advocate for children and families across the spectrum, making sure that families have the resources and the supports they need to raise their children. And she often is serving very resource poor communities. And so she knows the difficulties that her families face, and she is right there to work with them. She has served as president of the Georgia Association, the Georgia chapter of the American Academy of Pediatrics, and in that role advocated for children at the policy level. She is also involved in a wide variety of injury prevention efforts, both at the state and national level, including child abuse prevention in that. She is just a tireless advocate for families, and I was just very pleased that we were able to give her this award this year.
And so Angie is accepting that on behalf, but we will be posting these for everyone to view later and in our follow-up emails, some of the wonderful information about our two award recipients this year. And so I just wanted to remind you guys of all of the great sessions we have coming up today. At 9:30, we're going to have child and adolescent mental health and resilience, and also reconsidering neglect, how a thoughtful assessment, diagnosis, and management can change outcomes. And a little bit that does include poverty. I saw someone put in the chat boxes or any mention of poverty within this conference. So that's a really great one for you to attend. And then at 10:45, creating a culture of LGBTQI+ affirming care, along with supporting the mental health of infants, young children, and families in Georgia. And then at noon, we are having our sponsored networking event to hear resources from them. Please join us. And at 1 p.m., we will have Dr. Sanu, who I think we have a big fan club for here in the audience today. So Dr. Sanu will be talking all about trauma and ASIS with us at 1 p.m. And you can find all of those under your schedule and a join link to session. So we'll see you guys at 9:30 and get started with the rest of today. Have a great one.